Do you think that it's your cancer doctor's responsibility to go outside the box of traditional Western mainstream medicine to learn about alternatives and nutritional supplements in treating their cancer patients?
I sure do.
Well, many cancer patients use vitamins and minerals and herbs, but they're afraid to tell their oncologists. And patients don't like cancer treatments, and they're often open to something natural without the side effects. But medical doctors usually resist the use of supplements in favor of the chemotherapy and radiation, claiming that the supplements could be dangerous. So do you think that they have an obligation to learn outside their training?
Well, it's not fair to them because of the way they're trained. But yes, they absolutely have an obligation to know everything they can about treating their patients who have very serious life-threatening diseases like cancer.
And don't you think they would want to?
I would want to, and I have, and I'm not even an oncologist, because I think that we have that obligation to do what our patients need, whether it's something that we're taught in our training or not.
And most of the people that have cancer, they start going on the internet and trying to see what else there is out there, because people don't want the real mainstream treatments.
Well, they don't want to suffer. I mean, who wants to go through all the symptoms that you get from the treatment itself? Can't blame them for wanting to find other ways to do it, or at least to find ways to alleviate the symptoms some, or to even add something that might be better than what they're getting.
So what does it do to the patient-doctor communication when the doctor's not open to being receptive to listening about these things? Because the patients usually come to the office with the questions.
Sure. Well, it becomes deceptive is what happens, because the patients are in fear that if they talk to the doctor about things that either the doctor doesn't approve of or the doctor doesn't know about, if that happens, then there's going to be a discussion that's not necessarily going to be a friendly one. And too many oncologists just have a negative attitude about it. They won't look at the other side of the picture. And they're not the only ones. The complementary and alternative doctors have the same problem. They often are just saying, yeah, you're cut, poisoning, and burning when you're doing radiation, chemotherapy, and surgery. And both sides are true. There are disadvantages to both. But don't you as a patient want the best of both worlds? I mean, we haven't solved the cancer problem. People are still dying from cancer. And until they're not, our obligation is to try and find ways to help them, no matter what it is.
I know, it's really too bad, because the patients are wanting so much, and they're so desperate a lot of the time, to talk about all this, and yet they're afraid.
Oh, a lot of this is about money talking. You're looking at an industry where there are billions and billions of dollars every year that come in profits from the sale of drugs, the chemotherapy drugs, both for the industry as well as for the oncologists who, when they're independent, make 25% of their income from the sale of drugs.
It's like a conflict of interest, for sure.
It's a clear conflict of interest. So we need to find ways to go back to the old way that doctors used to be, where they cared for their patients. They did anything they could, and money wasn't at the root of determining what could and couldn't be done.
Because, see, too, the other thing that happens is that many times when people get a diagnosis like this, they're so upset, and they're not even hearing what the doctor's telling them in the office. They don't even know what the doctor said if you ask them when they walk out of there.
Oh, and the doctors rush you through. Oh, you've got cancer, you've got to treat it as soon as possible, and we're going to do it the way I do it in my practice.
So a lot of the reason that they pick the treatment that they do is because they're scared to death.
Well,
to not do it.
It's intimidating to listen to your oncologist or your complementary alternative doctor say, this is the only way you should treat this cancer, and the longer you wait, the more dangerous it is. Let's get started.
Well, I think that all people, and I mean all people, that have a diagnosis like this need to get other opinions.
Absolutely.
And I think it's helpful to get opinions from both camps.
Absolutely.
From Western medicine and from alternatives.
Well,
and then decide what you want to do. And don't allow them to just panic you into doing it right yesterday,
Exactly. Well, that's why I'm personally in the process of making a video that's an integrative cancer treatment approach. It's like integrative oncology, where we have a radiation oncologist, an oncologist, two people who are complementary alternative doctors, a third one who is a doctor that has cancer herself, the patient, and myself as a moderator. And what we're doing in this video is looking at the different ways that you can approach treating a cancer and talking about the advantages and disadvantages, meaning the benefits and the side effects and other risks that we might see from those treatments. And I'll tell you, it's a whole lot different story than what you see in oncology, in the treatment of oncology, either in complementary and alternative medicine or in the mainstream. Because when you have the patient yourself in front of you and no one else there to challenge the things you say, it's often a different story than when all these people are together and you're asking the questions in the presence of everybody. The answers often are a lot more conservative and reasonable than when they have you by yourself.
Yeah. And it's good for somebody also to always have somebody with them when they're discussing their care.
Absolutely.
Because it's like having an advocate.
Mm-hmm.
But one of the things that I was thinking of, though, that I just wanted to bring up here as an aside, is that you did a video on our website, drsaputo.com, on artemisinin in treating cancer. And you've gotten a huge response off of this particular video. And I've noticed that most of your answers to the people that inquire about it, you tell them to take this information to their doctor and discuss it. And so what I'm curious to know is, do you hear back what happens when they talk to their doctor?
Yeah, a lot of them talk to their doctor, Vicki, and they get a positive response, particularly in those stage 4 cancers that are far advanced, which is meaning that these doctors care. And I'm getting emails from all over the world, from Algeria and from Portugal and Spain and Australia, of people asking about this video. There were over 200,000 people who viewed the video, and a lot of people very interested in using it as a sole treatment, which, of course, I don't recommend. So I've sent them back information so that they can consider the data with their oncologist to try and make the best decision. Then I stand by waiting to hear if they have questions. And that's a good way to do it. So we need a straightforward, integrative approach, and we need the support of all the disciplines that are out there that can add anything to managing the symptoms of treatment, to managing the treatment of cancer itself. And if we do that, we're going to do an awful lot better than if we have this competitive, adversarial approach to my way is better than your way, and we're just going to do it the way I want. And unfortunately, medicine today has a stranglehold on what kind of treatment we get. And until the payment system changes so that all disciplines that are certified by the states that they're practiced in are able to have reimbursement for services, this is going to continue, because what we have is a turf war between I want you as a patient because I want you to see me so I can treat you and make money from it. And it's not the constructive team approach where it takes a village to really solve this problem.